Um, okay, everyone, let's get started. Welcome on behalf of the SingHealth Duke-NUS Global Health Institute. I'm delighted to welcome all of you to this third and final webinar in this three-part webinar series. The world's attention is understandably focused on how to manage the current pandemic, but in this webinar series, we shift the focus to an examination of the broader question of why such a virus originated in the first place. In the first two webinars, we described the role of evolutionary and ecological factors that can result in pandemics like COVID-19 and outlined a One Health approach to understanding the importance of using surveillance and other strategies to prevent and manage potential outbreaks. You can access those recordings of these webinars on our YouTube channel and on our website, but today we will look at how to prevent these future occurrences of such pandemics. We have an excellent panel of speakers from different disciplines and to help us pull some of these strings together, and we really look forward to hearing their perspectives, which are quite varied. Our moderator for today is Professor Linfa Wang, who is the director of the Emerging Infectious Diseases Program at Duke-NUS Medical School and a faculty of the Global Health Institute. Professor Wang has been involved with research related to bat viruses for over 25 years, so much so that he's now called Batman. He's been at the forefront of major research breakthroughs during the current situation and is involved in global level to help coordinate responses and guide strategies. Before I hand over to him to introduce the panelists, a few housekeeping notes. This webinar will be recorded. Please keep yourself on mute at all times, and you can post questions via the chat box at any time during the presentations. However, they'll be addressed once the presentations have been completed. I look forward to the discussions, and over to you, Linfa.
Thank you, Amelia. Yeah, so just a housekeeping that, we do have 20-25 minutes for Q&A at the end, but during the talk, if you have questions, just put into the chat box, and then I will go through and select. Okay, so it's my great pleasure to introduce, our three distinguished speakers. So I'm going to introduce all of them in the front so that they can seamlessly go through the presentation. So the first we have is Dr. Mark Stafford Smith from CSIRO. Currently, he's honorary fellow. And Mark's expertise is in adaptation and sustainable development. Internationally, he has served as a senior advisor to chair the Global Environment Facility Scientific and Technical Advisory Panel in Washington, D.C. And he also play a very important role in Future Earth Australia. It's a very important program. So that's our first speaker. And our second speaker is Professor Stuart Blaxell, and currently is a senior research scientist. So he is based in the Mahidol Oxford Tropical Medicine Research Unit, or MURU, in Bangkok. Stuart has quite a few, positions in Oxford, in Open University, University of Sydney. His expertise is really in biorisk zoonosis and in diagnostics. And last but not least, we have Dr. Katinka DeBarro, who currently is at the FAO regional office in Bangkok, but she has worked in WHO, and very importantly, I think now she is the local point for the FAO OIE. For those of you not familiar, OIE is the World Health Organization for Animal Health, and WHO, tripartite regional collaboration. I mean, this is very important if we want to prevent future pandemics, So time is limited, I don't want to go much longer, so I will let Mark to start the first presentation. Mark, over to you, please.
Great, thank you, Linfa. Can you see my screen all right?
Yes.
That's great. All right, thank you very much. Thank you for the kind introduction. Probably the first thing I should say about myself, though, is that I really know very little about diseases. Unfortunately, you have two people following who will fill in that gap. And so what I want to talk about in this sort of first talk, which is going very broad, is really this challenge we have in trying to prevent future pandemics of not fighting the last war. So that old saying that generals are always preparing to fight the last war rather than the next one. And I want to frame that through the lens of thinking about resilience. And so I've got three main points to address here. The first one is the idea, which I think is really useful in the resilience literature, of the difference between specified resilience and general resilience. So specified resilience is, they're both necessary, but specified resilience is where we get ready for the thing that we know could happen. But of course the risk is that something else happens. So we get ready for a flu outbreak, but in fact COVID comes along, which I think is part of what the UK was doing. And certainly for myself here sitting in Australia, I've been sitting through the bushfires in January, and I was already writing stuff about bushfires and climate change. And then COVID comes along instead, which was a completely different sort of disaster. So general resilience, by contrast, is being ready for the unexpected, for those black swan events that we don't really know quite what's coming, as well as being prepared for the predictable, but importantly, being ready for those unexpected things. And really, what I want to touch on briefly is whether or not our mental models and the way we approach things and our economic models are suited to this, and how we can at least have some checklist of issues to think about to be ready for that if they're not. So the second point I want to make is that to do that we have to be thinking in terms of systems, and I think we've got an incredibly valuable systems framework for us to use these days, thanks to the Sustainable Development Goals, where we have those 17 goals. Of course, there's a load of targets and indicators as well, but forgetting those, just concentrating on the 17 big goals, we have this remarkable framework where you can take any particular goal, like health, for example, and you can put it in the middle here and ask, well, how does achieving the health goal help us achieve or not achieve the other goals? And how does achieving the other goals affect our ability to meet the health goal? And so we can do that sort of thinking, and we can do it, for example, with emerging infectious diseases, and think about how, and use the whole systems thinking structure there of the SDGs to think about the other factors that come into play when we're worrying about emerging diseases. So we actually did a bit of this in a paper that came out in PNAS earlier this year. It was actually written last year, but very timely as it turned out, and they rushed it out in February when it became apparent there was a pandemic going on. And it was specifically thinking about pandemic risk and thinking about the links between pandemics coming from zoonotic sources, and how that linked to things like biodiversity management and the management and clearing of our forests, food production and the pressures that it puts on those forests, but also the proximity that it makes between humans and animals and so on. And there's a whole sequence of issues, of interactions that come up there, and some of those come up very much, I think, in thinking about surveillance and issues to do with food, which the other speakers will pick up. The point I want to make here particularly is that actually they're only the thin end of the wedge of the interactions across the SDGs, because it's easy to see how issues to do with poverty and equality, education have really affected the way the pandemic's played out, and obviously affect many other sorts of disasters or events as well. Obviously the nature of our cities, issues to do with climate change, and even things like whether areas are in conflict or not, and whether the infrastructure is in place. All these things have a role to play in how the impacts of something like a pandemic plays out. So the question is, how can we think about these in a broader way? And if you think about all of these issues, really there are some common drivers, more than just these, but some key common drivers that sit behind these, which might lead to issues that we think about in terms of resilience. Obviously there's population change going on, demographic change, migration and so on. We do have really rampant consumption, which is driven very much by our economic model at this time. And that sits behind a lot of these issues, whether it's climate change or the increasing loss of forests and people coming in closer contact with some of these zoonotic diseases. So to my third point then, how do we go about building general resilience? Well, there's actually quite good understanding of some of the sort of main features of a more generally resilient society as opposed to a less resilient one that are emerging in the resilience literature now. There's a book by Brian Walker I've noted on the screen here, which is a nice sort of popular introduction to all of this. But there are a whole series of attributes which we can at least expect and need to have if we want to have a generally resilient approach to things. And I'm not going to go through them in detail, but I just want to pick out 2 or 3 and show how incompatible with our economic norms they are at the moment. So one of the ones that people talk about a lot is the need to maintain response diversity. That's having a whole variety of different ways of doing things, whether it's diversification in agriculture or whether it's diversification in supply chains and value chains, such as we saw failing in many countries where they needed to get PPE from other countries that were actually needing it themselves. We certainly saw that here in Australia. I think we saw supply chain problems for toilet rolls as well, but that's a different sort of issue. But this general idea of having diverse approaches, which in an economic sense is seen as redundancy and inefficiency, but actually it's a crucial long-term mode of tackling uncertainty in the future. Along with that goes having reserves, and that could be reserves in terms of financial reserves, but it can also be reserves in terms of human capacity, many other forms of reserves, obviously material things like oil supplies and things like that. A second area which sort of links to that is having the appropriate levels of connectivity. So the economic models tend to imply that just having more connectivity is a good thing, but of course there's some balance there. Having no connectivity is not a good thing, but having too much allows very rapid spread of diseases, allows very rapid spread of misinformation, and so on. So actually a resilient society has a balanced level of connectivity, and it thinks about that a lot in all sorts of different ways. And then the third thing I want to just touch on is valuing social capital, particularly valuing the sort of networks and the institutions and the ability for institutions to work together, which is something which you can't easily put economic efficiency measures on, and so we tend to grossly devalue. Now, I think Tinker's going to pick up that in terms of international institutions in a moment, so I won't say much more. But the point there, as with all these other things, is that our economic norms, the sort of basics of neoliberal capitalism, tend to push us away from encouraging these things to happen. So the message I want to leave with you is really this, that all of these resilience issues are important for building resilience to pandemics anyway, because we don't want to just build resilience to the last pandemic, we want to build it to the next potential one. But they're also all the more vital if we're trying to build general resilience for the broader suite of black swan events that could happen, which may or may not include pandemics and may or may not interact with them. And so, you know, as a practical thing, I think one can actually have this checklist of resilience attributes sitting by your desk, whether you're a student thinking about future work and things that you might do, or whether you're a practitioner worrying about whether you've got supplies of PPE in your hospital, or whether you're a researcher thinking, or a policymaker thinking about whether you're making the right policies. And you can just be continually asking yourself, are we addressing these, are we designing our policies or our hospitals or our whatever in ways which allow these factors to be valued? Because very often we're doing it in ways which actually devalue them, and that is simply going to reduce our resilience. So that's really all I had to say there, and back to you, Linfer, which I'll put this bat on here for you. You're still on mute, just to warn you.
Thank Mark, and for the excellent presentation, also being on time. So let's move to Stuart next.
Right, we'll just get this screen sharing business sorted out.
Sure.
And can you see that okay?
Yeah, beautiful.
All right. So thanks to the organisers for asking me to give this presentation. The context, of course, is topical, and I really only want to concentrate on two organisations, but really a lot of organisations are working in the biosafety sphere. And really I want to just acknowledge a couple of programs, but also look at the opportunities for the future. So what is biosafety and what is biocontainment? Well, really it's making sure that your staff, the colleagues in the laboratory and the environment remain safe from the infectious diseases that we work with. So it's confining those biohazards to a point where they are not dangerous to others. And I like to think of it like insurance, and that is, it's just an investment that you hope you don't have to call on, but if the worst happens, then you've got it. And I think it's that financial balance that we always have to make, that we have to invest in the future, and biosafety is money well spent. In terms of preparing for the next pandemic, we may only have a limited opportunity in the biosafety field to actually prevent pandemics, but we can certainly prepare for them. And so what WHO and FAO have done through regional programs and global programs is to advocate for improved biosafety, and that's generally done through their headquarters respectively in Geneva and Rome, and then it's then out to the regional and the national offices where the implementation takes place. What all of these organisations do is they also produce some excellent guidance, and I'll talk more about that in a moment, and training and needs assessments, so lab assessments, so you can work out where the gaps are. So in terms of preparedness, in terms of addressing where the gaps are, this is the way to go about it. So let's look at the tools, if you like. So how do we get that preparedness message out to the field? Well, what WHO, FAO, and other international organisations are very good at doing is putting together technical documents. And so WHO has the Laboratory Biosafety Manual, FAO has the Biosafety Primer, and these are key documents, but it's not just those, because they are very technical in their essence, and in terms of being able to have easy to digest documents, we also have SOPs and other guidance manuals that allow for easy implementation. So the example that we would normally use of these key documents is the WHO Biosafety Manual. And I've gone to this particular document because it's in its 4th edition at the moment. It's just about to be released. It's a single core document with 8 companion monographs. It's focusing more on people, less on buildings, because people are really the essence of biosafety, and ensuring that they follow rules, regulations, and good practices. And it's really using risk and evidence base rather than just having more and more complicated buildings. And we went and tested the waters with a position paper, and we were very happy to have very positive feedback. It's much better than the other way. In terms of biosafety guidance, WHO, again, very proactive in terms of providing very clear and reasonably concise guidance in terms of what is the best way to work with these pandemic threats. So, and the important thing is that with the COVID-19, it's been an evolutionary process of guidance to ensure that laboratories are following as best they can. I just want to touch briefly on laboratory biosafety assessments. So these are performed throughout the globe by both WHO and FAO. The FAO program we've been involved with through the MORU program, and we've been able to identify key biosafety gaps. And in terms of preparedness, if you know where the gaps are, that you can then fill them, and you can fill them with, in terms of capacity, with training or the purchase of equipment. But also, we have limited capacity in terms of biosafety professionals to go out and perform these types of assessments. So what's really important is that we train people in the field to be able to go out and do these assessments, and then feed back in to the regional laboratories or the regional hubs, so that we can make decisions about how we can best invest in people, that is training, and in technical equipment. So when it comes to training, both FAO and WHO play a very important role. So once we identify what the gaps are, then we can target our training appropriately. So WHO have some excellent online tools. So we have the online training platform from WHO, and there's some excellent COVID-19 specific training, and that's on the open WHO platform. There's also a number of WHO biosafety videos, and the links to both of those resources is on this slide. So what WHO tends to do is they have a lot of specific guidance. The FAO training tends to be a lot more hands-on, and we've been involved in that types of training. So it's a lot of face-to-face, it's a lot of spending time with people and working through problems together. So it's ensuring that people understand hazards, understand risk, in terms of working in a laboratory with different types of personal protective equipment and what to do in cases of emergency. So it's the hands-on training that is exceptionally important in times of when you need it. Heading towards the end of the presentation, so FAO also has a extensive biosafety certification program, either in the areas of training, but also in the areas of contracting others to go out and do biosafety cabinet testing. This is very important in terms of understanding if the biosafety cabinets are working and performing as they should in situ. So as we head towards the end of the presentation, so what are the impacts of these programs? Improved awareness of biosafety, standardized documentation, developed standard training, understanding of risk and risk mitigation, and also it allows us to work with other global partners such as DETRA, USAID, CDC, and OIE. And so I'm going to leave you with a final thought. There's been a lot of discussion about a potential breach in Wuhan where COVID-19 originated. The thing is, we don't know. And unless someone puts their hand up, we will never know. However, we must continue to support best practice in biosafety and biocontaminant at every level and not be distracted. So I'll leave you with those thoughts, and thank you very much to the organisers and to the participants. Thank you.
Thank you, Stuart. Yeah, the last slide was certainly, it will be a never-ending question, I guess.
Sure.
All right, so Katinka, you can start to load your slides. And while you're loading the slide, I just remind all the audience that you don't have to wait until the Q&A time. If you have any question, type in now, okay, so we can actually screen through. Thank you. Katinka, it's up to you. Yeah.
Okay, thank you very much. I hope you can all see my screen.
Yes.
And thank you very much for this invitation to be part of this fantastic seminar. I've watched the other two sessions and they were absolutely excellent. And I think they provided a very good overview. Now, you know, the task you have given us, you know, how we can prevent future pandemics, it's a big question, but extremely relevant. So let me just quickly, you know, there are many factors that has been also discussed in other presentations previously, that we live in a rapidly changing world. There is so much going on: climate change, increasing populations, urbanization, deforestation. There's so many things happening. And keeping track and an inventory of all these different changes that certainly have an influence on diseases. So just to one word about the FAO, the Food and Agriculture Organization of the United Nations. Actually, our mandate is to build a world without hunger. So I work in the Animal Health and Production Service, which is a small part. We have forestry, fisheries, socioeconomics, and maybe some of you might know FAO's stat, the statistics. Many of the reports are based on the statistics that we collect annually about various aspects of food and agriculture. So we have 193 member countries, and our direct interlocutors are the ministers of agriculture, of the 993 member countries that come together in Rome every 2 years to discuss the work of FAO. So it's very much through the governments that our activities get kind of decided on. Then on the Sustainable Development Goal, as Mark already mentioned, we have here no poverty, SDG2, no hunger. These are the main to which FAO contributes and is custodian of some of the indicators, but also good health and climate action, life on land and responsible consumptions, and many to the others where we contribute. I just wanted to, I don't know if this animation starts, but possibly not. Well, I just wanted to mention that highly pathogenic avian influenza, H5N1, was when the whole One Health approach actually became kind of received momentum, because there was the realization there was this disease in poultry, and there was the risk of people becoming infected and actually people dying. So in total nowadays, it looks like very little. There were about 700 people who got infected H5N1, and about 60% of them died. But there was a great threat of the pandemic. There was a big risk that this could be a pandemic. So the realization also that diseases come from animals, and it is not enough just buying Tamiflu, but you need to address it in the animal population. And here also the wild birds were the ones carrying the disease, and the disease moved from Asia into Europe and Africa, most likely through the wild birds. So in 2010, FAO, OIE, and WHO, and OIE was mentioned already, it's the World Organization for Animal Health. It's not a UN organization, but it's an organization that actually was established when rinderpest was ravaging the world, came together to decide that there is a need to share responsibility and coordinate global activities to address the risks that actually are at the animal-human ecosystems interface. So in other words, One Health. In 2018, the three director generals came together, and already there had been a decision to work on zoonotic influenza, rabies, food safety, but also antimicrobial resistance. And often you hear it's the silent pandemic. Also antimicrobial resistance is moving rapidly, and it needs very much this collaboration between animal production, where antibiotics are being used, in human health, but also the environment. I often call it the soup where everything comes together. If we think the effluence of farms and slaughterhouses where a lot of the animal waste gets into. So in early detection, rapid response, it's the idea in epidemiology to flatten the curve, to be early there in case of an outbreak, and to have means in place to respond rapidly to this. So I just wanted to mention various international early warning and response systems and tools that are available. Possibly most of you know the International Health Regulation. That's more for the human health side. In the animal health side, the OIE has also something very similar. There is obligatory reporting of specific notifiable diseases, and they often relate either that they have a big impact on trade, or they are impact on public health, or they have a big economic impact. FAO, OIE, and WHO jointly also have the Global Early Warning System for transboundary animal and zoonotic diseases. So this is a platform where not only the official reporting, but also the reporting that comes through, for example, websites or unofficial reporting comes together. In the food safety side, there is something similar. There is Infosan, but then I don't know to what extent it's known, but ProMed, HealthMed, and the Global Health Observatory are other means for information exchange. There's also a rapid response network, the GORN network, with 250 institutions that work with WHO to deploy rapidly teams to the field. This was very prominent during the Ebola outbreak. And FAO OIE have a similar emergency animal health center. Just to mention briefly here the external evaluations that very much tries to assess countries' capacities to prevent, detect, and respond to international or to hazards that have an impact on public health. And here also FAO and OIE joined to this mission specifically to look into antimicrobial resistance, zoonotic diseases, and food safety, where certainly this One Health approach is very much needed. There are several mechanisms that we use to help also countries to improve their capacities, because once we assess them, we can see the gaps and where we need capacity building. I just mentioned here rinderpest, the first animal disease that was eradicated, and there are many lessons that we learned from there. And actually looking at kind of the jargon that is being used for this current pandemic, talking about herd immunity, it's very much an animal health word, let's say, because there we talk about herd immunity. But there are many things that I think also from the animal health side could be learned. And here specifically, I would mention the progressive control pathway that has been developed for FMD and other diseases that helps countries to define which stage they are and clearly how they can move forward. I will not go more into the Animal Health Center, but just to finalize my presentation, we need to understand, first of all, the social determinants of health. Like poverty is one of the key drivers for many of these diseases. First of all, it could play to the emergence of the diseases, but also the difficulties in addressing them. And we need to have international and national platforms where we bring the different disciplines together, where there's consultation and dialogue. And again, I want to stress the importance of early warning, rapid response, and capacity building in countries. They need to develop clear strategies, how they can approach diseases that are currently available, but also especially to respond to emerging diseases that might occur. And then it's not always easy, emergency preparedness, but it's very important to find the means also to have emergency funds. And I very much recommend the conduction of simulation exercises in countries that it's very good to prepare, to see where the gaps are. So with this, understanding, what are the different drivers, what are the capacities? If we understand the situation, we can address it. But there are also many uncertainties, and we have seen it with this pandemic. Initially, we didn't know the extent of it, the transmission routes, and to acknowledge these uncertainties and try to address them. So with this, I would really like to thank you all for your attention. Thank you.
Thank you, Inga. Thank you very much. So again, reminding our audience, okay, if you have questions, please enter this in your chat box. And we have quite a few questions already. So I'm gonna choose the one in the order so that I will ask the first presenter the first question. So Mark, this is a question for you. It's not gonna be easy, but all the questions are good, but a difficult question. The first question is that, how do you engage governments who are on a 4-year or even 3-year cycles to commit to long-term agendas like climate change and epidemic preparedness? So you're the expert in, sustainability and the resilience. So I thought that this is your question.
Yeah, sure. Thank you. A very easy question indeed. I think there are some important points, though. I haven't got an easy answer to it, or I'd be running the world or something. But I think, I think firstly, I'll make 2 points. One is that to get that sort of transformation, we have to often take small steps. Occasionally a big disaster or crisis creates an opportunity to really make changes. But actually, we need to have set up the system beforehand. We need to have implemented a whole series of small things which push the system in the right direction in order that you can make those changes in a crisis like the current one. And so the sorts of things that I was talking about, and which I think Katinka then just talked about in her last slide there, of making sure those things were in place, I think those are some of the sorts of things which can help set up governments to recognize when a crisis happens, that the places which had those in place are able to deal with things and have fewer deaths and less economic impact than others. And then hopefully that enables other countries to make changes. But I mean, secondly, I don't think we should underrate the challenges that come from that. I mean, one of the key issues, I see another question here about WHO having mixed reviews. And I mean, you know, one of the key issues you'd have to say is that, in a resilience sense, is that if we don't invest in organizations like that, as we see one or two countries who shall remain nameless thinking about disinvesting, then we will have no chance of being resilient, and that'll come back to the countries themselves too. So I think continuing to make that message and encourage, at least in democratic countries, electors to appreciate that they need leaders who are taking that longer term time frame is really important. And I think actually having the simulation exercises you talked about, Katinka, talking about what might happen if something went wrong, is a big eye opener both for the politicians and the general population.
Mm-hmm. Thank you. So Stuart, the question to you is that concept you mentioned, you know, biosafety and all the preparedness is like a bioinsurance, you know. So we both, you know, Stuart and I used to work in the Australian Animal Health Laboratory. It's a very expensive biocontainment. And the argument we have to the government is always, you know, that's the insurance. Now, so for insurance, we pay for a house. If it's $1 million house, maybe we pay $2,000 a year. So for this, what is a good ratio of insurance, you think? You know, I mean, you know, COVID-19, I don't know how many trillions of dollars, you know.
Yeah.
So that's another question, really, you know, at the government or organization level. You know, it's a difficult question, but I'd like to hear your opinion on that.
Well, thank you, Lin Far. I appreciate it. I think this is a question that is at the front of the mind of most people who are in our positions. You know, we often advocate for these laboratories, and then we have to run them. And the management costs, the ongoing maintenance is certainly significant. However, if we look at the ongoing cost of COVID-19, again, it is very much like that insurance policy. And it's not just laboratories, and it's not just biosafety, it's the pandemic threat surveillance programs. Now, I mean, we can talk about PREDICT and some of the other programs that have been funded by the US government, for example, and some of the others. Really, I see them as being wonderful programs in terms of providing eyes and ears out into the field as to what's potentially out there. However, if we continue to do a wonderful job and actually keep the pandemic threat at bay, then of course what tends to happen is people forget about us and they say, well, it's not so important. So this is why I think it's our job as people at the more management level, and maybe with a bit of a profile, to advocate for the funding, advocate for the awareness, advocate that if we don't maintain this level of preparedness and awareness, then what's going to happen is that the worst case could happen, and that's what we're experiencing now. So I think when I started in this business, Lin Far, you'll remember that my job description was quite different. And now I tend to find nowadays I'm spending a lot of my time advocating for funds to prepare for disease. And I think it's just something that we need to do nowadays. Without this, we don't have the resources to be able to do our jobs. So I think we sort of become politicians ourselves. And it's up to us to keep on fighting that fight.
Yeah, no, I could not agree with you more, because, you know, I'm running an emerging infectious disease program. I always complain about, you know, during peacetime when there's no outbreak, nobody will fund you. You try to find, you know, give you money. But, you know, now people just throw money at you, want a solution yesterday, you know. So I think that's the difficult. That's what I think your insurance policy concept, I really like it. You know, how can we implement and what kind of ratio? This is something that I personally very interested, because this is really a lesson. For example, SARS is one example. You know, after SARS, you know, we have all this research to try to go to vaccine and therapeutics, but people say, why bother? It's never going to come back, right? So now SARS-2 comes back, you know, 100 times worse than SARS, and we were not ready, even 17 years later. Yeah.
I think the point you make, and of course, I haven't answered your question, but the ratio, I think, is something that we will only be able to estimate once this pandemic has subsided. And there are health economists out there who are far more prepared than myself to be able to make those judgment calls. But the level of disruption, not only to one's personal life, but to the economy, is immense. And so we must be prepared to pay that insurance cost up front.
Yeah, the interesting part is every country has a clear budget for military preparedness, right? Defense. And I always say, you know, for infectious disease, it's like the impact like COVID-19, you know, most people are saying, you know, it's going to be worse than any world war, you know. So that's another angle, you know, nationally and internationally, really people need to rethink about why we have a fixed defense, you know, budget, but we don't have a fixed pandemic prepared budget, both at the international and the national level. But anyway, this is a big topic, you know, and let's go to the not so big, but it's equally difficult topic for Katinka, you know. WHO and FAO and OIE, you know, when you have outbreaks, you know, people always try to say you overreacted or you underreacted, right? So currently there's already, you know, this question is said WHO, you know, has had mixed reviews regarding the handling of the ongoing pandemic. You know, what are the challenges this organization has, you know, and such organization have in managing a situation like that. So I thought maybe you are closest. We don't have a WHO representative, but you worked at the WHO in the past, you know. So I will let you to address this question first.
Yeah, thank you. Well, it's not an easy question to answer, but it's always, you need to take decisions with many unknown factors. I remember when H1N1 broke out in Mexico. At that time, we had a mission going to Mexico to investigate because there were pigs dying, and there was the idea it was coming from pigs. And clearly at that time, we didn't know what was happening, what would happen. It looked like the transmission was going very fast. There were many people infected. Initially, also quite a few died. And I must say at that time, I think WHO took the right decision calling it a pandemic. Afterwards, WHO was very much criticized, saying that they called the pandemic. In the end, you know, not many more people died than for normal flu. But certainly it's very difficult when you don't have all the information. After that, WHO became very cautious. And I think with Ebola, they were maybe too cautious. And also now this time, you know, because you never do it right somehow. There will always be criticism. And one thing I would like to advocate, I know you are in the scientific institute. The big problem is that often there is a disconnect between science and policy making. The science, it takes sometimes too long to come out because you need to publish, and there is the whole peer review process. But policymakers, they want immediate information. They want to have something to base on. And maybe we can improve this communication between scientists and policymakers. And I think there the international organizations can play a role in being this platform by having, you know, experts coming together, providing advice also to the policymakers and also to higher management in the international organizations, because we rely very much on the scientific community and not always all the information is available. Maybe also a little bit walking to the question that was posed to Mark, you know, it's 4 years cycle. I think international agreements, if we look at the Paris Accord, for example, on climate change, it is binding for countries for a longer period. It's not only a political cycle of a president. Or if we have like global strategies for disease control. And in the animal health side, we have, for example, for rabies, together with WHO and OIE, we have a global strategy where we look to eliminate dog-transmitted human rabies by 2030. So having these kind of clear strategies will, and these strategies are normally signed and endorsed by all the member countries, would give the political leverage for longer than just a 4-year cycle.
Thank you. Thank you. So I'm going through these questions, and one of them I think is more to Stuart, so says, yeah, can virus be controlled basically at the animal population levels such as bats, so I think the more general question I think is wildlife basically, I mean, the theory is the wildlife is transmitting the virus to us. So would it be better to prevent the pandemics by better control of the virus in the animal population?
Is that to me, Linfa?
Yeah.
Thank you very much. Katinka, if you would like to contribute to this one, and maybe Linfa as well. So I don't think that's practical. However, I think, again, it gets back to awareness, doesn't it? Mm-hmm. So what we do know is that there is, and this is why we run our surveillance programs, zoonotic surveillance programs. So we're looking for pandemic threats all the time. And what we do know is that there are certain species that are more likely to carry disease of pandemic threat. And therefore, this is where the live market issue then becomes, the wet market issue becomes a real issue. So my contribution to this particular topic is we need to really then look at how we can control the wet markets and prevent transmission in that sense.
Yeah, so I was going to follow this with Katinka, at the FAO, it's to do with food, right? So, I'm a Chinese, and people keep saying there's a 5,000 years of history of wildlife animal trade, live animal trading. So from FAO and international bodies' point of view, there's lots of debate, and especially from the Western media, it says simple, just ban them. I mean, obviously it's not that simple because you basically drive them underground, right?
Exactly.
So maybe I like you to really, ponder on that. This is very hot right now, in terms of wildlife and the live animal trading. Yeah.
Well, thank you very much for this question. Yes, and in FAO we have a lot of discussion about it. If we think of the illegal wild animal trade, it's, if I'm not mistaken, the third after arms and drugs in the world. So it's huge, and there's a lot of money involved. So clearly, as you say, the wet market is only one aspect of it. And that would not be enough, just banning it. We know that it depends very much also which animal species are being traded and what kind of risk. With regard to the wet markets, clearly there's a lot of livelihoods that depend on them. And to ban it from one day to the other, it's certainly not an option that we favor. We see clearly there is improvement in the wet markets. There is also in the time of avian influenza, the way of, for example, closing the market one day in the week for cleaning and disinfection, advising people not to take back animals to their farms. So there are certain interventions in which you can improve. I think the question was also a little bit towards, can you control diseases in wild animals? I think it will depend very much on the disease and on which animals. And again, my favorite topic, rabies, if I go back to foxes in Europe, where rabies was controlled in foxes through oral baits with vaccine given to foxes. But this was a particular species, and it was possible to vaccinate them that way. Bats, for example, in Latin America, there are the vampire bats that transmit rabies there. And people have tried to control the disease in the bats, and it's virtually impossible. And also the huge ecological impact you would have, for example, by trying to eliminate the animals. Like also was tried, for example, in Crimea with wild birds. There was a time, the idea during avian influenza, let's kill all the wild birds. Well, they're part of the system, and we are the ones encroaching. And I think human behavior needs to adapt to the animals, to the wild animals we live in. Maybe back also to, there is a big sector on wild animal farming. And I think there also clearly improvements can be made, and and it needs to be looked at, you know, what is viable and what not, which animal species. And we know if animals are kept under bad conditions, they will fall sick and they will die and they will most likely transmit diseases.
That's right.
So a lot has to do with communication and also awareness. And in the end, if there is no demand, there will be no supply. But as long as there is demand, there will always be a supply. So a lot has to do also with public awareness.
Sure. Now, the next question that I have is really at the high level. You know, you're the local sort of focal point for this tripartite, you know, WHO, OIE, and the FAO. At the same time, you know, I'm on the World One Health sort of organized committee, and you are very actually in this, you know. So this is, I'm going to go for Mark as well, you know, that in terms of internationally, that to increase the efficiency of difficult issues to handle, we have 3 organizations right now, FAO, WHO, and OIE, tripartite. Can we make it a monopartite, just called OHO, you know, One Health Organization, you know, so that, you know, so Mark, you have a go first, and I'll ask Katinka to come in. Is this, you know, I mean, no, I worked with all 3 organizations, and it's just so gigantic. To do any change is not easy. But again, like, you know, COVID-19, you know, I'm sitting on committees that sometimes just the communication across the organization, you know, nationally and internationally, is very inefficient. So Mark, you have a go first to say, you know.
Yeah, I mean, there's some really important points in that, I think, which actually do speak to resilience as well.
Yeah.
I mean, in one sense, if you're going to do that, you would say, well, actually, there's a whole lot of other issues that aren't even within the purview of those 3 organizations, which both Stuart and Katinka have mentioned as well. And they go through to things like equality and poverty and so on. And of course, there is an organization called the UN, which is supposed to attempt to try and cover all of those things in an international context. And maybe that's what one has to do to try and draw the strands together. I will say that, you know, one of the things I didn't talk about in resilience thinking in relation, in a general sense, is having systems, institutions which don't have too high overheads in administration, and in the broadest of senses, in terms of the ways they operate and the inefficiencies of the internal dimensions of the organizations. And I mean, in that regard, UN organizations aren't necessarily the best ones in the world, even though there are a lot of extremely good things going on there. And so, I mean, I think there's a real trade-off here between having a smaller organization that potentially is a bit more nimble, even if you might not call WHO that, but I mean, it is potentially more nimble than the entire UN system. But on the other hand, then tends to be siloed from some of the other issues that need to be handled. So, I mean, my own personal preference is that you have a very strong, I think ultimately that whatever you do, you always have silos, right? The issue is not which silos to have, it's how do you operate across those silos effectively, or try not to have them as silos. And so I think the real issue here is establishing good interorganizational cooperation in the sort of way that Katinka was talking about, but potentially doing it in a much more widespread way. And if I could just finish with a point back to the question of how much do you insure, I think something that we don't do enough explicitly of is actually trying to analyze the answer to that sort of question, and how much redundancy do you have in the system, how much reserves, how much multiple pathways for doing the same things. And it's not none, and it's not a lot, it's not too much. But actually taking the opportunity of a crisis like this to really get a good analysis afterwards, which does provide some hard data on the sort of costs and benefits, and compares it with other ones like the H1N1 however many it is.
H1N1,
right, thank you. I mean, being able to make comparisons between those is very important in order to look forwards. Sorry, there's a lot more to say on that.
Thank you. I think COVID-19 will force people to do this kind of analysis.
I agree.
Katinka, do you have anything to add on that topic of the tripartite and how we can work more efficiently?
Yes, I think it will depend also on the topics. For example, on antimicrobial resistance, we're now engaging very much with UNEP. This is the United Nations Environmental Programme. I think that has been our weak point, engaging the environment sector. And often when we talk One Health, you know, the environment sector says, well, we don't have anything, you know, to contribute. And it needs more explanation. They have a very huge part to contribute. And if we see also in countries, it's very siloed. You have the Ministry of Health, the Ministry of Agriculture, and the Ministry of Environment, and they often don't talk to each other. And one thing that we found, what is absolutely important, and therefore I showed this tripartite director generals coming together. It's the same at country level. You need to get your ministers to agree to work together. Otherwise, your lower levels will always be more hesitant to establish these linkages. And one thing is also trust between the different groups. And therefore, in a way, to have meetings and people meet each other can be very important to establish these linkages. And I always ask, you know, if there is a group of people that are supposed to collaborate, do you have each other's email and telephone number? You know, are you able to call up the person in case of need in the other sector? So there is need at high level to have this good, you know, kind of collaboration acknowledged.
Okay, thank you. And time is quickly running out, you know, but there's a last question specific to Mark. You know, you have a slide saying capitalism is not working. So can you sort of elaborate a bit, you know, go over the conversation beyond the health realm, you know?
Yeah. Well, I could elaborate on this for several hours, but in 1 minute.
you have 2 minutes. You have 2 minutes. Okay.
Oh, 2, right. Okay, well, that's double as much. No, I mean, the key point I think I'd make here is thinking about changing the measures of how we assess human well-being in our public space. So at the moment, like it or not, it is by far dominantly in terms of economic terms and particularly in terms of GDP. But of course, there is a huge growing movement to think about wider environmental accounts and actually thinking about other elements of human well-being. And again, actually, the SDGs provide a great framework for thinking about the breadth of this, but there are more specific approaches like the genuine progress indicator and so on. And I think, you know, if you wanted a single thing, because there isn't a single thing, there's a lot of things needed here, but if you wanted a single thing, it would be to try and implement that more broadly and to make it more and more the thing we see on TV instead of, or possibly as well as GDP on the news every night.
Thank you, all three distinguished speakers. And I said in my opening, this is a tough, you know, topic. And as we expected, you get all tough questions, right? So I always say, you know, in terms of how to prevent future pandemics, if somebody have a simple, easy answer, you will get a Nobel Prize in no time, you know. So with that, I'd like to conclude this session. I hand back to Amina.
I just want to end by saying a big warm thank you to all the speakers and to our moderator. I think we had some really interesting points raised up and certainly some areas of action for the future. And just to the audience, I'd like to say, please look out for our next webinar series, which will be in July, which will look at health inequalities, the impact of COVID-19 on health inequalities in the ASEAN region. So again, a lot of things to talk about that. And thank you all. It was great sharing this 1 hour with you. Bye-bye.
Thank you. Bye-bye, everybody.
Thank you so much. Bye-bye.